Hi, I'm Dr. Lesley Goth, and I got a very important question that I want to go over with you. It's very deep. It could be a trigger, so here's your little trigger warning. I'm a trauma specialist. I help people heal from trauma, sexual assault, and I'm here as a resource for you to help you heal and just to kind of give you information so you know you're not crazy, okay? So I got this very important question, and I want you to follow for more because I'm going to kind of give you an overview today and then break it down into smaller bite-sized pieces in the days to come. The question was, what are some of the responses as an adult if you were sexually assaulted or molested as a child? So I wrote some notes, and I'm going to go through things, like I said, give you an overview and then break things down into smaller bite-sized pieces over the next several videos, okay? So remember, follow for more. So what are some common responses? Let's talk about the emotional responses first. So a normal emotional response if you were molested or sexually assaulted as a child and you are now an adult. Shame and guilt. That's numero uno. That's why I wrote my book that will be coming out this summer. It's all about how to heal from the shame and the guilt that you are carrying as a survivor. So that's very normal. Anger, very normal as an adult to have just this kind of quick fuse, maybe some deep-seated rage in there, very normal. Sadness and depression, very normal. Anxiety and fear. Those are all normal consequences of being molested or sexually assaulted as a child. Let's talk about coping mechanisms as an adult. It's very normal to be an avoider, right? Just avoid things or people or places that could in any way, shape, or form get you close to being hurt again or remind you of the trauma, okay? Substance use, addiction is very, very common for survivors of sexual assault and trauma as a child. Self-destructive behavior, so that could be an eating disorder, it could be self-harm, it could be risky, impulsive behaviors, things like that. Interpersonal relationships can be quite challenging for an adult survivor of sexual assault you were sexually assaulted as a child. For example, difficulty trusting other people, very, very challenging. Tendency to isolate would be very normal, and just also feeling very hypervigilant, but also having kind of like an anxious avoidant attachment with people would be very normal, okay? What are some physical responses as an adult if it happened to you as a child? Somatic symptoms. So a lot of survivors will have physical symptoms like chronic pain, gastrointestinal issues like digestive issues or other stress-related ailments. Also, autoimmune issues are very common to develop over a lifetime if you've suffered that as a child. There could also be sexual dysfunction. There could be promiscuity, like a hypersexuality, or there could be an avoidance of it or a fear of it, okay? Cognitive responses that are very normal as an adult. Flashbacks or intrusive thoughts and difficulty concentrating, okay? So everyone is different. So you may have some of those, you may have all of those, you may have none of those. This is just information and a resource for you. Let me know if you have questions. Like I said, I'm going to be breaking these down into smaller pieces over the next several videos. But I hope that helps normalize that if you are an adult and you suffered this as a child, that what you're experiencing is really normal and you're not crazy and you can get help and support for your healing. Okay? Follow me here. Follow me on Instagram in case TikTok goes away. I'm Trauma Healer 11 on Instagram. And I will see you next time. Thanks for the follow. Bye.